Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is what you need to know about trigger point injections. What exactly is a trigger point? It is a tender and painful area of muscle. It represents hyper-irritable spots in muscle that are associated with palpable nodules in taut bands of muscle fiber, so you can often actually feel the trigger point. It can manifest as back pain, it can be tension headache, ringing in the ears, tinnitus, TMJ pain, decreased range of motion in the legs, and like I said, low back pain. Palpation of the trigger point will often elicit pain right over the affected area and also might radiate pain into other areas around the affected. Well, what is a trigger point injection? It's an outpatient injection. It's given right into the trigger point area. It may consist of dry needling, which actually has no medication. It's just where the needle goes in. It also may include some numbing medicine and possibly some steroid. It does not require image guidance. You're not actually going into the spinal cord area or any of the bony joints. It's just into the muscle tissue. And the needle does not go very deep. It's deeper than subcutaneous, but it's not past the muscle area. So what does the injection help? Well, there's quite a few things that it can be good for. Myofascial pain, which is basically chronic pain in muscle tissue. It can be very good for fibromyalgia, those with tension headaches, ringing in the ears, tinnitus, TMJ pain, and low back spasms, and also neck spasms as well. How is the procedure performed? It's outpatient. It only takes a few minutes. You don't need any image guidance. Needle is placed directly into the muscle area of tightness, and typically a small twitch can be seen and felt. It can be just a dry needle. Like I said, you don't have any medication at all. Or it may have some lidocaine or some bupivacaine and possibly some steroid medication. The needle itself with the dry needling can relieve pain, and the doctor will move the needle in and out of the affected area. And the injection can be repeated every few weeks. Well, what are the results? The results are typically excellent for relieving the pain due to trigger points. May need repeat injections every few weeks. There have not been large-scale studies looking at these, but if you look at smaller studies and the anecdotal reports of pain doctors, the results are just great. It's a very low-risk procedure and often has very high benefit. So the downside is absolutely minimal. You may end up having if you use a steroid, it may have some fat absorption. So if you use steroid too much, you can actually end up getting a little bit of a dent in the skin there because of it. As usual with any procedure, there's a slight risk of infection or allergic reaction. And one of the bigger risks is that it may not work. But the downside is so little that it's an outpatient, few-minute procedure. Don't even need image guidance. So there's minimal risk. The top pain management clinics in the greater Las Vegas area is Nevada Pain. They offer comprehensive pain management with medical and interventional pain treatments, chiropractic, physical rehab, spinal decompression therapy. They have several locations accepting over 50 insurances and providing over 50 treatment options. All the pain doctors are board certified. They've won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 702-323-0553 and visit us on the web at painmanagementlasvegas.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.